Hi, moms and dads. I am Dr. Kim Shepard with Align Family Wellness in Forsyth, Illinois. I am so excited that you took the first step to schedule an appointment and get your kiddo seen for chiropractic care in our office. We are so grateful. And I just want to take a few minutes to introduce myself, give you a little background on how this day one experience is going to go, and just to welcome you to the chiropractic care community. I know you are apprehensive. I'm just going to, go ahead and talk about the elephant in the room. You probably don't know much about chiropractic other than what you've seen on TikTok, which can be super scary. And so I want to ease your fears and to assure you that you are in the right place and that we will take such good care of your kiddo. And so I have been a chiropractor for over 22 years. My background was in sports and pain management, and I decided that my love of treating kids and pediatrics was something that I needed to dive headfirst in. Our office only sees basically infants, kiddos, and moms that are either trying to conceive during their pregnancy, postpartum care, and into mom stress. And so, sorry, dads, we don't see dads in our office or, elderly patients, but we are really good at what we do. And so we focus on that and we really niche down. I have a lot of certifications. I have a Webster certification, which is a pregnancy technique for chiropractic. I am a certified pediatric and family wellness chiropractic specialist. I am also a certified lactation professional. So if you're a mama and you're coming in for our lactation appointments along with baby, know that myself and Kaylee, our other lactation professional, will be with you and caring for you and baby during your appointment. So, I am also a specialist I've got some extra education in tongue ties and just oral ties in general. So this is what we do all day, every day. So you are in good hands and you are in a specialist office. And that is why we care for this specific population of people, because no one else in this town is caring for these people. And so we knew that mamas and babies were a special population that needed special education and special treatment. And so we have jumped headfirst into that. So I want to tell you a little bit about what happens day one. I'm sure you had a wonderful phone call with one of my amazing staff members that kind of walked you through how day one is going to go, but we'll just talk through it. So if you are coming in as a pediatric patient, we have probably texted you the pediatric paperwork because we know you are a busy mom. And so that you can fill that out on your phone and it will be submitted to us. So we will have that ahead of time. It gives me a lot of information. We make a lot of notes on that paperwork. So if you could get that to us before you come in, that saves me a lot of time and energy. But we also get it if life is overwhelming and you don't have a chance to do that. We are happy to provide you with that paperwork when you come into the office. So if you haven't done your paperwork ahead of time, you'll come in, you'll do answer some questions. It's going to be questions that you haven't really been asked before. A lot of questions about your pregnancy, about your birth, the first, few days of baby's life, kind of what's going on, because we are focused on how you baked and birthed your baby, how that baby was in utero, what happened during birth, was there complications, was there stress? All of that gives me such good information. So be as detailed as possible because that gives us so much information, knowing ahead of time maybe what sort of things could be going on with baby. After you fill out your paperwork, you'll sign a few consent forms, things like that. We also will, welcome you when you come in. We're so excited that you're there. So there will be a little sign with your kiddo's name on it. But we will give you an office tour. And I know that sounds silly, like you can find the bathroom if you want to, but we want you to see the office. We want you to see what we do. We want to show you the treatment rooms. We want to show you our lactation rooms. We want you to meet the staff. So we will walk you around the office and introduce you to everyone and just make you feel at home. So once we put you back in our one of our consult rooms, one of the staff members will come in and they'll go through your paperwork with you, and we will ask some additional questions and get a little bit of extra information from you that maybe wasn't clear in the paperwork or we need a little bit of clarity on. Usually then we'll move right into doing a scan on your baby. Our neurologic scans they have no emissions, no radiation. They are super, super safe. We can do them on 2-day-old newborns, pregnant mamas, anybody who steps in our office gets one of these neurologic scans. And the importance of the scans is it tells us numerous things. So for your baby, we're going to try to get a heart rate variability scan on them. If their earlobe is big enough, they get a little earlobe clip. And that tells me how stressed their nervous system is. And this is really, really important for our babies with colic that are just fussy and gassy. Then we will do what's called a rolling thermal exam. And so it's just almost like looks like a little car that rolls down their spine. You, mom or dad, will hold baby and we'll just have them in their diaper and roll the little thermal. And the thermal is like thermography. It checks for temperature balance. If we're looking for misalignments in nerves that could give us a clue as to what's going on with baby. So once baby gets scanned, we will have you comfort them, whether that's, if you need to bottle feed them, hold them, nurse them. If you're there for one of our lactation appointments, Kaylee will come in, and if you are nursing, kind of go through her lactation assessment right then. If not, you will finally get to meet me and I will come in person. We'll talk a little bit, then we'll start doing an exam on baby. And it's just really simple and really calming for baby. We do look in their mouth. We do some oral work. I'll feel around with some gloved hands. I'll feel around on their spine, ask you a few more questions, and just really answer any questions that you have and really make sure you guys are comfortable with our process. If they didn't get scanned initially, they'll get scanned before they leave. And so the first day is just kind of our dive deep day. We spend a lot of time listening to you, listening to any questions that you may have for us, answering any apprehensions that you have. We will usually not be performing any sort of treatment on that first day. It is just basically our CSI day or uncovering day. Once you are finished with the scans, then you'll move up to the front desk and kind of double check your next appointment for your day 2. And then I will sit down with your information and with your kiddo scan and really put together a full plan and look at that scan in detail and mark it up for you and just really make sure that we have all the information that we need to decide if we can help you help baby and make a good plan from there. So that is day 1. Plan to be in our office a good hour. We'll make you as comfortable as possible. We have, areas that you can nurse baby privately, change diapers. We've got diapers, we've got, water, we've got LaCroix, we've got whatever you need, snacks, food. If you have to bring other kiddos along, we totally do understand that, and we will accommodate that as much as possible. The first couple of visits are usually a little bit longer, so it's a little bit hard to have other kids, but we get it. You're a mom, don't pay for daycare. We'd be happy to accommodate that. So I can't wait to see you. I can't wait to meet you. Thank you again for being part of our family and joining us here at Align Family Wellness as patients. And so you will get another video from me after your first visit, and we'll go into what's going to happen day 2. See you soon.